The last time we were here, we had an overview into cervical cancer, and I had Mrs. Judith Asma-Kudjo with us, who gave us a very good insight into how we can be diagnosed early and have treatment so we recover from debilitating conditions such as cervical cancer. Tonight promises to be a very, very interesting one, and interesting for so many reasons.
That's right. Yeah.
I've got two of my cheerleaders with me, I should say, and these people I cherish so much for very obvious reasons we'll find out. But just so you know, we are live on Facebook and on YouTube. I am your host, I'm Mrs. Winnie Ohinikisi. I've got Dr. Robert Khan with me. Dr. Khan has been here on this show a number of times, and he's one of my main support systems for doing the show. And then a very honorable man who doubles up as my husband, Mr. Christian Ohinikisi. Tonight is going to be a struggle because I don't normally call him by his first name, so we will see how that goes. But I would say it is such an important topic, and I need you to share, keep sharing. All this is coming to you live from Omega Live Studio, Omega House Multimedia. If you need any help with all your studio works, with all your printing works, you will be in the right place to hook up with them, and you have a very good service. We are looking tonight at deep vein thrombosis and pulmonary embolism, and it's one of the catchy topics that keep coming up for so many reasons, and so I feel very privileged to have the chance to share this program. I would encourage you to share on all your platforms. Let's get the knowledge out there. Who knows, we could be saving lives. One of the main people backing me these days, and I keep making a whole lot of noise about it, is the Trowbridge Foundation. I know a lot of you are tuned in watching from the Trowbridge Foundation because we are going on a health mission. I will say a whole lot about it later on, but I want you to stay tuned in, find out why am I a woman on a mission to Ghana, and I'll tell you more. So let's get started. Dr. Robert Khan, you are very welcome once again.
Thank you, Winnie.
Deep vein thrombosis and pulmonary embolism, what is it?
It's just to begin, I think that I'll get Joe to show us our very first video, but before I describe what it is, I remember we had a conversation about people we know who had passed away with suspected clots in the lung and clots in the legs. It's quite a common condition, deep vein thrombosis. Basically, when you talk about deep veins, you're talking about the veins of the leg, and we'll show a diagram in a moment. In the body, you've got veins and you've got arteries. Now, many people who speak our local language call it in so many different ways, but basically they are like tubes that carry blood. The arteries mainly carry blood with oxygen around the body, and the veins carry the blood that have been used up back to the lungs to collect oxygen and then redistribute them through the heart to the rest of the body. Now, in the body, in terms of the vein system, there are some that are big, there are some that are small. There are some that are on the surface of the skin, and others that are buried deep in the muscle. So when you hear the word deep, it means veins that are deeply buried in the muscle. And then when you talk about thrombosis, now normally some people would hear the term VTE, or venous thromboembolism. Venous refers to vein, and when we say thrombo means a clot, and embolus means a clot that has broken away. So venous thromboembolism. So quite commonly you have this clot forming in the deep veins of the leg, quite commonly. And then when this clot is there, it breaks off, travels around the body. When it's traveling around the body, we call it an embolus if it's one, and emboli if it's many. And then when they move in, remember they are coming out of deeper, bigger veins. But then the blood system is also full of very tiny little veins and arteries that supply very vital organs. If you take the lungs, for example, when they branch out into the lungs, we'll show a picture of that. They supply what we call the sacs, the air sacs. So if you look at the diagram that the producer has kindly put on there, you would see what we call superficial vein and deep vein. Superficial means on the surface, and then deep means the veins that are quite deep. Not this video yet. If you give me the diagram of the leg, if you give me that diagram of the leg with the muscle, Uncle Joe. Now, what people don't understand is that, you know, we keep talking about exercising, walking, mobility. It is interesting that one of the main functions of this calf, or the tiaps, or what do you call it? Anentio, isn't it?
In our local language.
In our local language. Yeah. So the calves.
But anentio is the, what do you call it?
Is it not this one?
No, I know here is a different name.
Oh, and yes, excuse my chi. But basically, these calf muscles play such a crucial role. They act as pumps. So what they do is that the veins in the legs, these deep, solid, big veins, you know, when the blood goes down, it must come back up again. Yeah. Now you have fluid that has to, yes, that's right. If you look at these two diagrams, you would see the muscles of the calf on each side, and then you see the deep vein stuck between them. Now, when the muscles contract, they push the blood up this blood vessel system. Now, they do have what they call, some of them have valves. And what the valves are unidirectional. So imagine having a pump. You've got your pump sitting at the top of your house, isn't it? But you have to pump the water from downstairs to your third floor. It needs pressure. If you don't do this, if you don't have enough pressure, the water flows back, what they call refluxing, or it flows back down on itself. The same system applies in these veins as well. They've got valves. So when the muscles pump the blood and it goes up, it doesn't come back down unless the valves are weak before the water drops. When that happens, then you see people start developing all these, varicose veins and edema and all that. So the calves play an important role, which is why if you drive a lot or your job involves sitting down for prolonged periods of time, your calves are not working. When you are immobilized, for example, you're ill, you're bedbound, you've gone for an operation, you're not mobilizing. These are risk factors for DVT simply because the calves are not moving, the muscles are not moving. Yeah. Muscle movement is always good for the circulation. It keeps the pumps working. It keeps the blood flowing. It keeps fresh oxygen getting to the vital organs of the body. So whenever you hear the word DVT, it means clots forming in the deep veins in the body. Quite commonly the calves. It can happen in the thighs, in the deep veins of the thighs. It can happen in the big veins in the abdomen. It can happen anywhere in the body, but typically
in the thighs.
In the thighs, yeah.
Like you've rightly said, we know a few people who have actually fallen into this condition.
That's right, yeah.
And died. Why should we be worried about it? What is the statistics that we are
I think
dealing with?
Part of my concern was that, you know, you've got relatives back home. I lost a relative not too long ago as a result of a massive pulmonary embolus, a clot in the lung. Are you with me? And he's not the first one. I've had colleagues and friends whose relatives have died from similar circumstances. And a lot of times when you speak to a relative back home, for example, oh, what is wrong with, oh, he's not well, she's not well. Oh, what is wrong with you? I've been coughing, or I coughed up blood, or I had a temperature, or I had shortness of breath, tiredness. And then they told you that, oh, when I went to see the doctor said it was malaria. No, come on, hold on. I know we don't have resources in certain parts of the world, but not every cough is a malaria. I mean, malaria hardly gives you a cough. So you would think that, for example, a clinician would think broadly that it is not every cough that is pneumonia, that is chest infection. It commonly kills people, especially in Africa as well. Even in the United Kingdom, where we have the resources to do diagnostic tests instantly. I'll give you the statistics here. Uncle Joe, if you give me that first video of DVT on, get that running for me. If you look at in the UK, in a place where we have instant testing, it is said that 2 in 1,000 people of the population develop DVT. 2 in every 1,000 people. Annually, the incidence is 7 to 8 people per 10,000 who develop DVT or pulmonary embolism. Not this one. The other one with the vein with the blood flowing through. Is that the one? Yeah. Okay. Every year, there's an estimated 25,000 people in England that are diagnosed.
Every year.
Every year. And then you look at the statistics. I tried searching for the statistics in Africa, and it's interesting. It says that worldwide, there are about 10 million cases annually of, right, of VT. If you pause it there one moment, of either pulmonary embolism or DVT worldwide. In the US, about 300 up to 300,000 deaths every year from clots, and we're talking about an advanced country. In Europe, 544,000 venous VTE or venous thromboembolic related deaths every year, either from DVT or pulmonary embolism. That's in Europe. Then you go to Africa. Of course, Africa, we don't have much statistics because we don't document it. If you're not diagnosing it, you can't document it because we're misdiagnosing it. We're not picking them up. And then again, we don't have the resources to do all the investigation required to have an accurate diagnosis. Probably maybe the private clinics may be able to give us some statistics. But commonly, the statistics I found was about pregnant women, people who went for surgery, because pregnant women go to hospital. So if they die from a clot, you would definitely have that statistic. So in Africa, the information that I had here was that it says the prevalence of DVT between 2.4% and 9.6% in post-op patients. So if you take any number, 100 patients who went for surgery, you're talking about almost up to about 10% of them will develop.
That is very high.
That's very high. Do we actually diagnose them? No, the person has surgery, they go home, later on they go back to the hospital struggling to breathe. Unfortunately, I don't think we stop to think, oh, this could be a clot. Especially they've just had an operation, they are recuperating, they are not mobilizing. Could be a clot. Would we scream for it? Probably no. And then it said that and between 380 and 448 per 100,000 births per year in pregnant and postpartum women.
Wow,
that's a high.
That is a
high
number.
So one of the reasons, you remember, we said we wanted to do this was to highlight that, look, we know that there may not be resources, but it is common, it kills people. The good thing is that if you pick it up, something can be done about it.
Right.
I remember, I think sometimes when you speak to people back home, the whole problem is being able to afford the treatment. And certainly, if you even look here, where people have access to free healthcare and whatever, to actually take the medication for life in some cases, if you don't have the resources back home, you can't buy the medication.
It won't be affordable.
It won't be affordable. So it is an important condition. If you look at the numbers that we're quoting here, it kills people all the time.
Yeah.
Except we don't pick them up.
Yeah. I mean, that sets the scene beautifully.
That's right.
And I know for a lot of people watching tonight, they will be keen to listen to your story. But can we look at what puts people at risk?
Okay. If you play the first video for me, there's some information there so that yes, please. Yeah.
So that should be, yeah. What would put people at risk of getting this?
That's right. So remember, I mentioned the term immobility. Okay. So quite commonly, conditions that would make somebody not move the calves or not walking, not mobilizing, any condition that makes the blood slow down would predispose somebody to a risk. Now, blood flows at a high pace, and the blood cells are flowing at a high pace. If you have a situation where it becomes sluggish, then you are giving the red blood cells the opportunity to clump up and form a clot, because you've created what we call a dam effect. So if, for example, I'm sitting there the whole day, you remember that when you travel and you get off the plane from Ghana, what happens to your foot? It swells up.
Yeah.
It swells up because your calves have not been moving, so fluid pools in your leg. If you have the same scenario repeating itself day after day after day, what you're doing is that you're creating a risk factor to develop a clot in your legs.
Right.
Secondly, we talk about age. So if you talk about immobility, so for example, somebody who unfortunately maybe is bedbound, is bedridden, wheelchair bound, chair bound. You tend to see that in the very elderly. And that is why it increases with age. The older you are, the more at risk you are. Because when you're old, and when you look at the statistics, the percentage of patients less than 40 years of age who get it are less. After 50, the risk increases. Quite commonly, after 60 is when you start getting a lot of patients who start developing this if the risk factors are high. So immobility. So it comes to the point that people should walk. As long as the knees can hold up and the foot can hold up, walk. Then there are other illnesses that can cause immobility. For example, let's say somebody has had a fracture, they've got a plaster cast. Of course, it immobilizes you. The fact that you've got a plaster cast on even puts you at risk. So many people would understand that sometimes surgeons would put patients on blood thinners after they've had an operation on, say, a bone, pelvis, a major operation as well. Because those conditions make the person not mobilize or not walk enough. And then the circulation then slows down and creates that. There are, for example, cancer, for example, is known to be a predisposing factor as well. That certain medications patients take, it predisposes them. Long haul journeys. So by long haul, not going to France. France is short haul. But if you're going to Ghana, that's a 6-hour journey. And most of the time, people are sitting down crammed in the economy section. Even in the business section, how many people loiter around? And it's quite a long journey. So the advice always is that now and again, ideally, after every hour, stand up, stretch your legs and move about so that the circulation improves quite a bit. Any condition that damages the line in the inside of the vein predisposes. The inside of the vein is quite smooth, what we call the mucosal lining. Now, imagine that you have a breach of that surface. Then it almost creates like, if blood cells are flowing or fluid is flowing, let's say that you've got a free-flowing stream and you put stones onto the stream bed. What happens? It becomes turbulent. It is the same. Any conditions that creates turbulence in the vein or prevent smooth flow of blood in the vein can cause predispose you to DVT as well. Contraceptive pills, for example, which is why if somebody is going on to contraceptive pills or wants contraception, one of the commonest questions we ask is that, have you ever had a clot before? Have you had a clot in the lungs before? Have you had cancer before? We ask those questions that predispose the person. Because if, for example, you're going on combined contraception, the estrogen component has the ability to retain fluid. Now, if you're retaining fluid retention creates a risk for somebody, which is why if somebody, for example, has a heart failure, we put them on water tablet to get rid of the fluid, because the more fluid there is, it pulls up it causes what we call dependent edema. And dependent edema is always a risk factor for clots forming. And then pregnancy, the hormonal changes that go with it, and you see that the weight and the increased volume in circulation that accompanies pregnancy puts pregnant people at risk. It is why if you look at certain airlines, if a woman is about 30 weeks or more pregnant, when you're traveling, there are questions you have to answer, because the bigger the uterus, the more likely or the higher your risk of developing a clot in the leg if you are immobilized for a while. And then finally, obesity. You see, it keeps cropping up. Being excessively overweight keeps cropping up in cancer, keeps cropping up in diabetes, keeps cropping up in even DVT and pulmonary embolism, for the simple reason that it creates lack of mobility, or it makes the person less mobile and increases your risk of developing.
I think that sets the scene beautifully to bring Christian in at this stage. And I must say, one of my motivations for doing this program is his own encounter with this condition. And it came to a point when we thought, you know what, the more we talk about some of these experiences, the more we open people's eyes to some of the risks that we can encounter ourselves. So, Christian, you are very welcome to Let's Talk About Health. I know you are always behind the scenes. So, for any extra person who watches tonight, I'm sure they are keen because you are on. So, very welcome once again. And how did your own start?
Well, thank you, Winifred. I think it's all by God's grace that I'm alive, and that's one of the
Amen.
reasons why I decided to share this with
That's right.
everyone. I've had 5 incidents of blood clots, 5 episodes. The first one was in my lungs, and the other 4 were in my leg and thigh. Let me talk about the first one. It happened in 2004 when I traveled from Ghana to the UK. So that was about 6 hours flight. And I came with my 2 children, and one of them was not comfortable sitting on his own. So he sat on my lap almost throughout the journey. So I remember I hardly moved from my seat. I got up only once. So 3 days after I arrived, I started having breathing problems. And the evening of the 4th day, it's become so bad, and we called for help. We called for an ambulance, and I was taken to the hospital. And well, they said before they give me any treatment, they have to check certain markers in my blood, and that was going to take about 2 hours or more. And it got to a point I realized that I couldn't cope. So the doctors who were managing me took a decision and said they realized it's getting worse, so they would want to give me a blood thinner, and the quantity they were going to give me was such that it wasn't going to cause any problems, even if it's not blood clot. But this was after they've listened to my history, that I've traveled and all that. So when I was given this blood thinner, they gave it through my abdomen. And after about an hour, my breathing improved. Then after 2 hours, I regained complete breathing, normal breathing. And so they established that it must be blood clots in my lungs. That's why
Yeah.
I couldn't breathe.
And prior to this, you had not had any such episode of shortness of breath before.
No, prior to this, I had not, I don't think I had experienced any problem like that. And to be very honest with you, it was the very first time I heard about it.
Yeah. And you had had travels in the past. It wasn't like your very first flight ever, was it? It's just
No,
this time
no.
you were traveling with your kids and...
No, I've had travels before that I had no problems. And I remember I used to get up and walk, but this time it was because of my little boy who didn't want to sit anywhere other than my lap. So I sat at one place for a very long time. That's what I think I remember. And eventually, that was the problem I
Yeah.
had.
Yeah, what are some of the treatments you had on that day apart from the injection? Were there any other investigations on the day?
Yes, like I said, they first said they don't want to mistreat me, so they want to do some checks on my blood, and that was going to take some time. So they had to take an action before the blood results came. But when the results came, it wasn't very conclusive. But the interesting thing was that the injection that they gave me a big relief. And that's what made them conclude that it must be blood clots in my,
Right.
what do you call it, my lungs. But after that, all that I remember the date was they used camera and other things to check my internal organs
Yeah.
to see if there was something else wrong. But after this, I wasn't put on any health management system.
Yeah. So you have rightly mentioned that you've had a number of encounters, with the first one actually involving your lungs. And then you had another episode. So maybe let's forward to your second episode, which was, yeah.
Yes, the first episode was in 2004. After that, I was fine. I was living normally. Then in 2010,
That many years?
yes, 6 years,
Right.
Yep.
I experienced something different. I had not traveled, I had not done anything. I was just leading a normal life. Then I realized that my left leg was becoming painful when I walk or I take some steps. So later on, I realized that my calf was swelling.
Yeah.
It swelled up. So it kept on worsening. Then I realized that the veins around my calf had also swelled up,
Yeah.
and the skin around my calf had changed a little bit, become darker.
Yeah.
So these were the four main things that I saw.
Happened at the time. So what line of action did you take?
Well, I went to the GP and told them, and with the history of the first one, they didn't waste time at all. They
That's
said
right.
it must be this DVT. So I was referred to the hospital. When I got to the hospital, they first did a scan. They said it's called a Doppler scan. I hope
Yep.
I'm saying
Yeah.
it correctly.
It's a Doppler scan.
Yes. So when they did it, they realized that there was blood clots around my calf. So they gave me a blood thinning injection, and after that, I was put on a drug called warfarin.
Yeah.
I took it, I think, for about a year when they asked me to stop. But whilst I was taking the warfarin, I went for checks every 3 months or so because they said it has side effects.
Yeah.
So
Yeah.
that was what happened.
Yeah. Interestingly, you had the treatment for about a year and it stopped.
Yes. it did
Presumed to
stop.
have recovered from this condition, isn't
Yes,
it?
yes.
Yeah. And then it gets more interesting, but I think we will bring you in later. So, Dr. Khan, I mean, he has related very well to what the scene you
Yeah.
said, and it all adds up, makes
Yeah.
sense after a long haul flight
Yep.
and then having respiratory kind of symptoms. So, yeah, I think we will go on and look at the.
And many people, you see, it happens to many people. They travel sometimes
Yeah.
from here to Ghana, and then days after, oh, my feet look swollen, my calf looks swollen. When I'm walking, there's some pain, but they find a reason. Oh, some kind of reason, even though they've seen the swelling there. And the danger is that when the clot breaks off into the lung, then the sudden shortness of breath, and you know how our health system
Yeah.
is, within the space of days, they're gone.
Yeah.
Because it's a killer. So people, or maybe the person has been immobilized, has been quite unwell for quite a while, in bed for quite a while.
Yeah.
That's right. And then the risk factors kick in, and then they develop, just exactly as he's describing. It can happen in somebody who has never had any DVT before, or
Right.
never had a PE before.
Okay.
It is why in this country, for example, if somebody comes in and they've developed a first episode of pulmonary embolism, we would do all kinds of scans and all kinds of tests to find out why the person had developed a first pulmonary embolism or DVT, for example. So it can happen even when there are no risk factors.
Right.
When, say, you're not on contraception, you've not had cancer, you're not taking any particular medication, you've not even been on a long haul journey, but maybe your job involves just, for example, like ourselves, you sit in one position 12 to 13 hours seeing
Yeah.
patients the whole day with very limited walking. If you don't have an exercise regime that you do every day, then it means that you're putting yourself at risk of developing DVT.
At risk.
At-
Right.
at risk, basically. So those are the risk factors. I really wanted Uncle Joe to show the second video for us because it talks about what you see when somebody develops DVT.
Right.
Is that okay? That's right. Okay.
Yeah. So, I mean, while we are waiting
Yeah.
for the video to roll,
Yeah.
is there any way for the person to tell
Yeah.
physically that a clot is developing and
That's
so
right.
to take action?
And certainly, he mentioned that the calves got bigger, they got redder, and because if you've got a clot sitting in a big vein, it means the fluid is not flowing. Imagine the drains that we have in Accra, if the drain is blocked, what happens? The fluid spills over, and then you have a flooding. In the vein, it's a tight space. So if you have a blockage of that vessel, it means that the blood flow is not going to be proper. Are you with me? Then the next thing you know is that the calf is swollen because fluid pools around it. Then it becomes red. Red because blood is warm, and then there's inflammation. The body's inflammatory system kicks in. It becomes tender, hot to touch, and it becomes quite big.
Yeah.
And commonly, as he rightly said, if you pop into A&E or you see your doctor, from the history straight away, sometimes the history doesn't even suggest, but soon as you see a swollen, red, tender, hot calf or hot leg, your first instinct is rule out a clot, because it's life-saving. If you miss it, even for a few days, it could be catastrophic for the patient.
So are there any other conditions that can present in a similar way?
Oh yes, not every swollen leg. For example, patients can develop cellulitis. There are patients with what we call lymphedema. Now, apart from the veins and the arteries, there are also certain tiny blood vessels around the body. We call them the lymphatic system. Now, when these are blocked, you see that they also cause swelling. And sometimes you would see the leg is swollen big. The difference is that it's not red and hot. With lymphedema, some people call it, in Ghana, some people call it, say, elephantiasis. That's what they call it, elephantiasis, because elephantiasis causes that. The legs look like an elephant's leg, basically. Okay, and that's lymphedema for you. Lymphedema is not the same as DVT. So when you see lymphedema, it's not. The history will tell you it is not. The examination will tell you that it is not. Not every shortness of breath and chest pain and coughing and blood is pulmonary embolism or a clot in the lung. But we rule it out. If somebody comes with sudden onset shortness of breath, for example, they've got a temperature with it, they've got a cough with it. If it's progressed, sometimes they may cough up blood as well. Then, which one is this? Is that excellent?
So that's the video to support.
That's right. Yeah.
Okay.
So if somebody is struggling to breathe and is of sudden onset, you look at the risk factors, and then your first instinct is that you rule out a clot until proven otherwise. So then you're quick to do investigations. If it turns out that it's not a clot, fine. If it turns out it's a chest infection, you treat it. A lot of times our instincts are proved right, and it's a lifesaver because a clot can kill the person instantly. And when it's found in the lungs.
So I guess this is when it's a pulmonary embolism, isn't it, in the lungs?
That's right. No, I think it's talking about the differences between DVT and then pulmonary embolism. How the clots start from the legs and then ends up in the lungs, and the conditions. So for example, you would see the factors that are being listed: the old age. I think my eyesight is good, isn't it? Pneumonia, so for example, which is surgery, infection of the lung,
fractures,
surgery. So when somebody, quite commonly, the surgery we're talking about is surgery of the pelvis, the legs, because these are things that mean that the person is not mobilized and they are bedbound, and it increases the risk. Fractures, for example, again, these are risk factors. For DVT as well. So as I said, when the person presents the symptoms, as Christian said, difficulty breathing, there was the history there that they've traveled. Your first instinct is that you're dealing with a clot. So you rule out a clot even before you start thinking about antibiotics, that it's pneumonia. Because not every cough is a pneumonia. So bringing Christian into the picture again. So you've had one episode which was a suspected pulmonary embolism, and then the first swelling you had ever in your leg, which they were able to narrow down straight away that it is a deep vein thrombosis. What sort of examinations did you have done in the acute phase when you were in hospital?
Well, they took a sample of my blood and they checked certain markers on it
called the D-dimer.
they checked the D dimer.
Yes.
Dr. Khan, that's so interesting because you know what? That's his favorite medical term.
Ah, wow.
Yeah, D
Because
dimer. So
I was told
yeah.
that my D dimer has gone up.
Yeah.
Yes. So after they've established that, then they gave me the blood thinning injection,
Yeah.
and then when the clots had dissolved, I was put on the warfarin for
A
some
year.
time. Yes.
Yeah.
For a year,
Yes,
isn't it?
Yes.
We would have thought that at least you would have been treated of it by now, especially because you were not doing any you are normally very active,
Yes.
you know, very sporty and that kind of thing. Yeah, but then you had a third episode,
Yes.
isn't it? Yeah. How long from when you were actually stopped from the warfarin did the third one come?
The third one came in 2015.
Yeah.
That was 5 years
5 years
after.
Yeah, the second episode.
Yeah.
Okay.
And when that happened, it was similar to the previous one.
As in the second
In the second
episode,
episode.
which
So,
involved your leg.
Yes.
Yeah.
So I didn't waste time at all. But this time, I wasn't put on the warfarin. They changed the medication
Okay.
to
Rivaroxaban.
Rivaroxaban.
Yeah.
So because I realized that the doctor wasn't too happy allowing me to take the warfarin because
It's got a lot of side effects.
yeah, he said I'm
isn't it?
too young for that. Yeah, so he gave me Rivaroxaban in the second instance, and I was encouraged to wear stockings, compression stockings, whenever I'm doing a long travel, or I think I'll be sitting idle for a long time.
Yeah.
Yeah. And there were other things they said to me as well, that I should be drinking water regularly and exercising while I'm sitting and all that.
Yeah, right. So this would be your third, because we are going through the 5
Yes.
that you've endured.
Yes.
And I say, I mean, you've lived to tell your story because people have just one episode,
Yes.
and unfortunately, it's enough
Yeah.
to take them out. Yeah. So you've had treatment for the first one, which was just the injections, and then you had you were put on warfarin. Yeah?
Yeah.
And then the warfarin was stopped. Now you are on your third episode, which you had Rivaroxaban for. Yeah. How long did you take that for? Because again, that stopped at some point. You were on Rivaroxaban for a while, isn't it?
Yes, I was on Rivaroxaban for 3 months.
For just 3 months.
For just 3 months.
For the third episode.
Yes.
Yeah. And was it changed to something else or?
No. In all this, what they do is that I'll be called and then my blood will be examined.
Yeah.
So I don't think I found out the reason why, but after 3 months they said they think it's okay, you can stop. So I stopped.
Yeah, so that was stopped. And then what happened when that was stopped?
Then when I thought everything was over, the following year, which is 2016, it happened again.
Wow.
Yeah.
And this time, when they checked, I had the clot in my calf and then in my thigh.
On your right leg.
Yes.
Yeah.
But I think there's also one thing I need to clarify. In the first episode, it happened with my left leg. The second episode, which happened in 2015, was also in my left leg. But the 2016 was my right leg. And it happens always one leg at a time.
Yeah.
And it's either the left
Or
or the right.
Yeah.
But the 2016, the clot had developed in my calf and then my
The
thigh.
Thigh. It was on its way up.
Yes.
Yeah, and obviously some major decisions were made at that time, and I want to establish the fact that like some people may have an incident and then that's it, they get managed and probably may not have it again, but that wasn't your case.
No.
Yeah, it had been a stop start for like 3 episodes. What happened after this?
Yes, after the 2016 incident, I think the doctors were more worried. So they gave me to a special person who was in charge of blood, which is
A hematologist.
a hematologist. So he did some investigations with my blood, and he came out with some decisions. In fact, one of the decisions they made was that I may have to take some tablets for the rest of my life.
Yeah.
Yeah.
But this time it wasn't the
Rivaroxaban.
Rivaroxaban.
Yeah.
I was given
Apixaban.
which they said that is more or less has less effects than the side effects than the previous ones.
Yeah.
So I take this tablet every day
Without fail.
without fail, and they said I would take it for the rest of my life. But thank God, these things are not so expensive here, so I'm able to pay for them and use them regularly.
Yeah, use them. You see, today we can make light work of this, but trust me, I mean, I was a mess, like in all of this, because the thought of having to lose my partner, my life partner, was just the scariest thing. So he, being a man, he's downplayed the urgency and how bad,
like most men are.
yes, how bad it really was, and it was bad. Even from the very first episode when he had to be in an ambulance with the shortness of breath, and he was actually dying, like and that is why we got into this, you know, like sharing our experiences in health for other people to know, because even up till today, a lot of the people very close to us don't know that he has been through all this, you know, and sometimes we swallow or bottle everything in, and it doesn't help. So we will come back to you, because it's getting more more interesting, because I'm sure many people would never have heard about lifelong treatment for a condition like deep vein thrombosis or pulmonary embolism. If you have joined us live, we are on Facebook and on YouTube. I've got Dr. Robert Khan with me. We've done so many sessions before, but tonight we are looking into this condition, and then we have Mr. Christian Ohinikisi here with me, and giving an in-depth account of his own encounter with PE. If you have not shared this, you know, this could be a lifesaver for a family or a friend, because I mean, generally our level of activity in our daily lives keeps reducing. We are using more cars, so even every distance that we could have made on foot, now we tend to make in a car, you see. So there are so many things that can potentially go very wrong if we are not keeping an eye on some of these little problems. But I wouldn't say little, it can be a massive problem. So Dr. Khan, let me come back to you. What should be the immediate assessment? Obviously he's given a brief account of what he encountered, but what should people expect?
Well, most of the things he said is right, and certainly I think one of the benefits we have in the UK is that people are well informed. And then also you've got the NHS, which is free at the point of care. So if you need it, you can either call NHS 111, call your GP, go to A&E.
Yeah.
But I think the advice I always give is that if, for example, all of a sudden you've been on a long haul journey, you've been unwell, you've had an illness, and suddenly your leg is swollen, it is hot, it is tender to touch. When you walk, there's pain. And this is out of character, or it happened all of a sudden, or over several days, or even within a week or whatever. Or maybe you've been on a journey, you've been ill, suddenly you can't breathe. You can see that the chest is tight. When you breathe in, you have pain. You're coughing. When you cough, there's pain. Something we call pleuritic type of pain. It is the kind of pain that makes the person doesn't want to breathe. So they start taking shallow breaths, and it leads to what we call hyperventilation. So you see that they're breathing quite fast, and then they develop what we call tachypnea, which is fast breathing, fast respiration. And it is simply because there's a clot lodged in the lungs. Now remember the function of the lungs. It takes in oxygen, and then the blood gets refreshed with this oxygen, and then it distributes it around the body. So if you have the main organ that has to take in the oxygen, and that organ is blocked by blood clots, it means that oxygen is not getting to the body. it causes pain, just as DVT causes pain here. It also causes pain. The clot causes pain here. So if you can't breathe, you've been on a journey, you're coughing, you're quite unwell, it doesn't matter the time of the day. My first advice would be dial 999.
Right.
Especially because, you see, when they come in and they suspect pulmonary embolism, intervention can be put in place which can save your life, because I can assure you PE can kill you instantly.
Yeah.
A clot can kill you. DVT at least may give you a bit of time. If it's DVT you're suspecting, if it's nighttime, if somebody can drive you to A&E, by all means make your way there. If it is daytime and you've got a good GP like mine,
Like you.
yes, that's right, where we have emergency appointments
Yeah.
for the day. Once you manage to give the call through, in the community we can have same day ultrasound. That is, after we've done risk assessment, we bring the patient in,
Okay.
and we know that this is not life threatening for today. Sometimes on the day we can actually start the injection in primary care before we send the patient in.
Right.
There are also the D-dimer test that you mentioned. We can do a finger prick test.
Is it?
Yes, right there
Okay.
in the GP surgery.
Oh, I didn't know that.
Well, you've
I
learned
see.
something today.
Yeah.
We can do a bedside test if the person's risks are high. That will give us an indication, but most commonly we tend not to waste time. The symptoms are classical anyway, but even when we are in doubt, because it's such a life-threatening condition, we would always get same-day ultrasound, what we call duplex ultrasound or Doppler ultrasound, and then as soon as that confirms the clot, in some cases we'll start treatment even before. If the person ends up in A&E, it is the same. Whilst they are doing the investigations, they would give you the injection, and the injection is like a clot buster. So you don't waste time with it. You have to break down the clots and dissolve them. Interestingly, people will be amazed that the reason, if somebody has a first episode of, say, pulmonary embolism or DVT, and it's what we call unprovoked. Unprovoked means they've never had it before. They don't have any illness. It happened spontaneously. Then normally we'll treat them for 6 months, because it takes up to 6 months to dissolve a clot.
That long?
That long.
Wow.
So you can't treat the person for just a month or two and assume. No, they will develop something with time, post-thrombotic syndrome. What he described as the clot building up into the thigh. It starts off small, then it builds up with time until it blocks the whole artery, and then the leg becomes very swollen, very hard, very painful with time. And that kind of a clot, if it dislodges into the lung, you're done for if you don't have access to treatment immediately. So first, if it's difficulty breathing, shortness of breath, you feel quite breathless, you've been on a journey, call 999 so that they can put intervention in place and take you to the hospital quickly.
Yeah.
If you don't have any breathing difficulty at all, okay, you can make your way to A&E. Once you make your way to A&E, they will do immediate blood test. They will do scans, CT scans, something we call CTPA, do scans to look for the clot as well. And in some cases, if somebody goes in with pulmonary embolism or a clot in the lung and it's unprovoked, there's no particular reason, we would do CT scan of the chest, of the abdomen, of the pelvis, looking for the reason why the person has developed. And then we'll do the duplex ultrasound of the lower limbs as well, just to make sure that no clot is hidden. In some cases, the reason the person had developed it suddenly is that you do the CT scan and you discover cancer as the source. Of what is
accidental finding.
Incidental finding, as we call it. So there's a reason we do all these investigations. And then once that is done, you're started on the treatment, as Christian said. Quite commonly, it is the injection you'll be started on. The reason for the injection is that the injection is a clot buster, so it acts quickly. You're normally on it for about a week, and patients maybe step down to warfarin. We used to use warfarin a lot, but as he said, because of the side effects and especially the monitoring of warfarin, because you have to go for checking INR all the time, either finger pricking or venesection, or taking the blood from the vein, and that's a bit of a nightmare. Especially we tend to find that with our very older patient, and this is where what we call the direct oral anticoagulants, the DOACs, apixaban, edoxaban, Rivaroxaban, they have been quite good in the sense that it doesn't require monitoring.
It's been life changing.
It's been life changing as well. So we use those a lot for long term
Yeah.
management of DVT and pulmonary embolism as well. Yeah.
That's really full on and a lot of information. So,
Yeah.
Christian, I'll come back to you.
Yes.
How life changing has this been? Has it been life changing at all?
Well, in terms of my physical activities, no, I would say no. I'm able
Obviously,
to do it.
apart from when it's in the acute phase
Yeah.
and limited, isn't
Yes.
it? By the pain.
But the first thing is, I have to take these tablets that I mentioned every day of my life. And if I stop it, the results could be catastrophic. For instance, last year, I had to do a procedure at the hospital. And it involves a little bit of
Surgical intervention.
surgical
isn't it?
intervention.
Yeah.
So my doctor and I had a discussion, and he said 1 week prior to the
Procedure.
to the procedure,
Yeah.
I shouldn't take the blood thinning tablets,
Yeah.
and then I should continue not taking it a week after.
Yeah.
So I stopped a week to the procedure. I did stop, but then 3 days after the procedure, my right leg started swelling.
Wow.
Yeah, because you had been off it for over a week
For
at
over
that
a
stage.
week. Plus 3 or 4 days. So, because the doctor had already discussed with me, I immediately started taking my my tablets, and
Yeah.
I made him aware, and he said I should start. Then these pains and swelling
Everything
disappeared.
just good. Yeah.
But that's what had convinced me that I should share this with a lot of people, so that anybody who has this condition, if you are given tablets to take for life, you shouldn't play with it at all. Because I stopped it for only, call it 11 days, and then
The clot came.
the clot came.
Yeah.
So
So because I was going to ask you that, you know, as a doctor, you prescribe medications for patients. And many times when the patient leaves your presence, not that you've had an agreement with the patient, you believe they would take it. You believe you've explained the significance of the
Yeah.
condition they have. And for somebody to take medication lifelong, it is not easy. We're creatures of habit. And sometimes I do a bit of negotiation with my patients that, look, I understand you're not taking one tablet, you're taking 2, 3, 4. Can you imagine you wake up in the morning, you've got 2 or 3 pills to swallow, then in the afternoon, remember to take it. Initially, you may be motivated. After a while,
Yeah.
you give up. People just give up. But as Christian has said, it is not like your ordinary statins that you say that I'm giving myself a drug holiday for a
Yeah.
month or 2. This is life-threatening. So unfortunately, if you developed a clot before and you've been put on the medication for life, then it is a lifesaver. Just take it that just as you eat every day
yeah.
and you drink every day, it is just something to extend your life and give you the quality of life. Because if you don't, it can be catastrophic.
Right. It
Yeah.
can be catastrophic.
Yeah.
And if I could link up with those who are watching on Facebook and YouTube, I would be very, very grateful. But in the meantime, we've been very full on from the beginning till now. So let me just chip this in. For those of you who are regular viewers of this show, you know I'm embarking on a mission with the Trowbridge Foundation. So what a lot of people have been asking me, what are you doing? What is this about and all that? So let me just give you just a little bit of information about the Trowbridge Foundation. And I always say thank you for inviting me to be part of the team going to Ghana. I think for the first time ever in my professional life, I feel like I've got something legitimate to give back to my my country. So just a brief insight into what the foundation is about. They are mainly into maternal and fetal health, maternal and child health, but it was started by some Ghanaians and some British joined in by some others from India. It is just an amazing small group of people who have seen the need and to bridge the gap between the health gap between an underdeveloped country like Ghana and one like UK. So they've successfully done 2 missions where they encourage team building. So what we are going to do, and I am so excited because I am actually not into midwifery or into maternal health, but the group actually wants to extend some of these services, good services, life-saving services back home in the motherland, I mean in Ghana, because who knows, I'm sure we can only get bigger and better. So we are going to some of these teaching institutions or health institutions, and what we're going to do is we are trying to get them to work as a team, something which they found over the years is not the case. The doctor works on their own, the nurse works on their own, and there is no collaboration. But to save lives, you need people to work as a team, and that is what happens in a developed place like in the UK. So we will be looking into topics like maternal resuscitation. What do we do if a pregnant mother, especially in labor, collapses? We will be doing that, and that is where a bit of my cardiology experience will probably come into play. And then we will look at maternal sepsis, shoulder dystocia. So we are not just looking at the mother, we are looking at the baby as well, because of the high mortality rates that exist in this part of the world. So people, you know, I've been making a whole lot of noise about it. In another part of the country, we will be going to a cardiac unit, and that is where I think I'll be in my element, because all my expertise will come into play. This is an amazing thing, and we will be leaving at the end of September. I would say, if I share and say contribute towards a worthy cause, this is the mission. So this is just a gist of what the Trowbridge Foundation is doing, and the Ghana Mission 2022 is about. And I'll say I have shared a lot. I encourage you all to donate, to support, because the group actually fund themselves, and we all have the same aim, is to save lives. End of story. You know, promoting training and group work and saving lives. So I hope I've made it just a little bit clear. So before we go, I will keep drumming it in. Please share with your friends and encourage people to donate. Who knows how far it will go to save the life of your family or friend back home in Ghana. That's the gist. So Dr. Khan, I know I've been drawing you slowly into all my events, and thank you so much for the support. But now let's look. The past 2 years we've been looking at, hearing a lot about COVID, clots, vaccines, clots. Where do we stand with this, especially because today we are talking about blood clots?
Right, okay. I believe there were people who thought that, oh, COVID causes what? Blood clots. It is not COVID per se that causes blood clots, no.
Right.
I did quite a bit of reading, bit of research around it. COVID doesn't predispose somebody to developing pulmonary embolism or DVT. Interestingly, quite a number of the papers that I read actually spoke about patients who went into intensive care. So same scenario, you have somebody who's developed severe COVID, almost like sepsis. Some of them develop sepsis. Some of them develop what we call disseminated intravascular coagulation as part of the sepsis.
Isn't it?
Yeah, that's right. The reason we give them blood thinners and all that is that if somebody is immobilized in intensive care with a severe infection like this, their chances of developing a blood clot is high. And that is why it predisposes them to developing a clot. But their risks are not any different from anybody with other risk factors. That's what many of the researchers find. So simply because somebody develops COVID doesn't predispose them to it. The difficulty, especially for people living in countries where medical services are not like here, is that if somebody develops COVID, their chances of it escalating is much higher. Thank God that we didn't have those severe cases that we had in the UK back in Ghana. You can imagine what would have happened there. But in answer to your question, it does not necessarily increase somebody's risk.
And the
of
vaccines?
developing- No, I've not read any link that the vaccines predispose somebody to clot, because there was so much information, a lot of theories and videos and whatever, that people were collapsing because of the vaccine or developing clot because of the vaccine. I wouldn't want to go there. There are so many people who have published so many things. Many of them are not really verified. COVID is a new disease. The vaccines are still new. Probably maybe in a few more years, when evidence is collated, we may be able to probably categorically state that maybe X vaccine or this vaccine or that vaccine may predispose somebody to developing the clot or PE. But the jury is still out.
No, it's still out. And there's this practice of always getting medication off the counter. And I think for a lot of people, aspirin is always one that is, is people just use it.
That's right.
Anyhow, what advice do you have for...
Aspirin is not an anticoagulant. It is not. Aspirin works in a different way to prevent what they call platelet aggregation.
Yeah.
You're dealing with platelet. That's what it's more like an antiplatelet sort of. Are you with me?
Yeah.
Even apixaban and doxaban, all these DOACs, they do not break down clots. What they do is that they thin the blood and prevent new clots from forming. So long term, when you take it, it is thinning the blood and preventing the clots from becoming bigger. But it doesn't go in to break down old clots. The body has its own mechanism of dealing with old clots there. For as long as the person is taking medication and doing the right things, with time the clots are broken down by the body's own defense system on its own. So aspirin, aspirin has been around for many years, and we know that now and again you would see a publication that says that it's good for the cardiovascular system, and then you would have another publication that says that it doesn't really. But it's still a good medication. It does a good job. But it is not a prevention that if I take aspirin that I don't develop clots. No, that's not what its function is.
Yeah, thank you very much. Now I have the link for those watching on Facebook, and I must say, I'm sure it must be Christian's influence. There are so many people online tonight, which is encouraging to see. And I would say that don't only come in to join us when Christian is here. I do this with Dr. Khan all the time. It's so amazing to see all of you joining in. And let me see who is here. And let me just put this in as well, that those watching live on YouTube, obviously I don't get to see who is watching on YouTube, but your contribution is just as important to me. But on Facebook, I can see a few people. So let me acknowledge them, and then I will take some of your questions and contributions from here as well. So Rodelyn Graham, who is my MOGA president, she is watching. Irene Alomenu, Lydia Enyan, Catherine Boche, Big Sis AC Hamon, who dresses us, and she always makes sure we are looking the part when we do the show. So Christian's outfit, my outfit, all sponsored by Big Sis AC Hamon. I can't
what
even
about my outfit?
your outfit. I know you are all watching from Ghana. I have Dr. Baijampo, Trowbridge Foundation. What will I do without you guys? You are always backing me, because tonight we are not even talking like maternity as such, but then because of the risk in even maternal health, they are always backing me. So let's see. Dr. Jampo says, let me see, does dehydration put one at risk?
Certainly.
The next few days is going to be hot in England, so risk of excessive sweating, dehydration may predispose us to
Yes,
clots.
it does.
Is it a factor?
It depends on for example, if you take patients that are debilitated, bedbound, you go to the care homes, are very elderly parents who barely move, hardly move. If the person is not drinking, it means that the circulation itself is almost like shut down. Are you with me? You need unless maybe there's a medical reason why somebody cannot take fluids. If you're a grown-up adult, at least 3 to 4 liters of fluid a day. How many people have that? No. So constantly, people feel dry. The mouth is dry. You feel tired. You feel fatigued because we don't get enough fluid. When the weather is hot, you have to drink. Because if you don't drink, yes, Dr. Jampo is right, it predisposes you.
It predisposes you.
Yeah, that's right, because the
Right.
circulation will be sluggish as well. Yeah.
Yeah, there is an interesting question from Doris Kessie. Doris, congratulations on qualifying as a cardiac nurse as well.
Wow.
I know you are always following me and I appreciate you so much. So thanks for watching. And she says, thanks for this discussion. Does it help wearing test stockings when on a long flight?
Yes, you may choose to wear. Certainly, it's not that it's a recommendation, but if you've got risk factors, then yes. If, for example, I'm traveling from here to Australia, let's say a direct flight, certainly I'll get one. Number one, because I'm not any younger. Number two, it's a very long haul flight. Number three, chances are that you'll be sitting down for prolonged periods of time.
Yeah.
So yes, test stockings are advisable to take. I think Christian mentioned the compression stocking. We do have patients who, after using the stocking for a while, they stop.
For a while they stop.
They stop completely because they think, I don't have any pain anymore. The swelling is gone.
Yeah.
Don't stop it because the risk is still there.
Yeah. And
What-
let me chip in this question.
Yeah.
Now you've said that. So with him who is on lifelong anticoagulation, does he still need to be wearing his test stockings?
Not necessarily, but in certain circumstances, if he's traveling, he needs to wear them
Okay.
because his risks are high. You're taking the medication, all right, but you're also placing yourself at extra risk.
Yeah.
So it is important that put on the test stocking, and then when you come back from your journey, you can take it off.
Yeah.
Yeah.
And let's see, Dr. Jampo says, to get 5 episodes of VT must be very scary.
It's a miracle.
Christian and Doctor, does that mean Christian probably has thrombophilia? Christian, has any family member of yours got it in the past? They all probably need screening. And he also goes to say there seems to be a genetic disposition. Now, that is what makes it interesting, because does any of your family have this condition?
No,
Not that you are aware
not
of.
that I'm
And,
aware
and
of.
in this country,
Yeah.
somebody who has had multiple DVTs or PE, hematology would always do a thrombophilia screen.
Screen.
Yes. Probably not like back home, but
Yeah.
here you would have a thrombophilia screen if you've had more than one episode
Yeah.
of DVT or PE.
Yeah.
You would.
And what we've had to do actually is to tell our kids about these health conditions running in our families. You know, because interestingly enough, a niece of mine, and AC is saying, yeah, I've had a close family who had it, and that, I think it was one of my nieces, and had a baby, had twins,
Yeah.
and obviously you said for a long time breastfeeding and had, I think it was pulmonary embolism.
And that's one of the risk factors
Yeah.
that is mentioned here. Women who are pregnant or have given birth within the previous 6 weeks.
Yeah.
Simply because, again, as you said, walking less, tired mom, sluggish circulation, the increased weight that
Yeah.
comes with pregnancy, the hormonal changes that come with it as well, predisposes the woman to the risk. Now, what we also say is that a pregnant uterus, for example, you remember that it puts pressure on the veins that drain the lower limbs and it makes it sluggish, which is why when you're pregnant and you sit for long periods of time, your legs become how do we
Engorged.
swollen and engorged. They say yes,
Yeah.
in local parlance. So it puts them at high risk. So the advice would be, if for example you've had a baby, they've given you test stockings to wear, especially when you had a cesarean section, don't discard it.
Yeah.
It is given to you for a reason, to help the blood pump. It helps the calf pump the blood
Yeah.
upwards into the body. So
Christian, I'll be coming to you. So,
Yeah.
but I'll ask the producer. He's kindly offered to show the state of his legs, even without an episode. Yeah.
Wow.
Then how his legs look after all the episodes that he's had, and I thought it was very brave to do that. So if we have the pictures of his legs, and it will be very interesting to see it, because you see his left leg and
That's
you
right.
see his right leg. If we can have that and show it to the viewers, and yeah, it's one of those things that we've decided.
I was going to ask you, when you look at the legs and you look at the way it looks, it's almost as if
I don't think it's on screen yet.
it's-
So
I can see it
you
from
can see
yeah, I
it.
can see it from
Yeah.
here.
yeah.
Did they tell you you've developed post-thrombotic syndrome, PTS, ever?
No.
No.
Because quite commonly when patients have had multiple clots over a period of time, you tend to see this picture, for example, where the leg almost looks swollen.
Yeah.
A lot of times, itching, sometimes cramping,
Yeah.
sometimes a bit of pain when you're walking, and it has that permanent look of PTS, post-traumatic
Yeah.
syndrome. It's not as severe as we see in the classical cases
Yeah.
of people
Yeah.
with chronic.
So obviously
yeah.
what they are seeing now, and obviously I get to see it when it's actually happening.
Yeah.
This is the best, like without any problem
Wow.
when it's in the non-acute phase. But in the acute phase, trust me, those veins that you can see, they are really engorged. And the leg is probably like 1.5 the size that
Yeah.
you can see now.
Yeah.
And
it's warm,
yeah,
Yeah.
warm to touch, all the signs of an inflammation going on.
and the skin
Isn't it?
changes a bit.
Yes.
Yeah. So now you can see it's cleared, and this is like the best. I'm saying his sexy legs. The best, bless him. The best that you can get his legs to be, and it's amazing because I'm sure the only reason why he's been able to keep going is because he's been managed carefully,
Yes.
and he's an expert patient as well. And I always emphasize how important it is for our patients or ourselves to take charge of our situation. So he's got all his records to date.
Do you know that without proper management, 10 to 30% of patients who develop pulmonary embolism and DVT die within a month?
Oh wow. Wow.
Yes, it's a real killer.
Yeah.
You joke with it, you're gone, and it doesn't give you the chance. See, that's the danger with the clot. Once the clot dislodges from the legs and then it gets into the lungs, it doesn't give you a chance.
Yeah.
If it's not picked up quickly, and within a few days you're gone.
Yeah.
Yeah.
Yeah. So, Dr. Khan, I think this has brought us to almost the top of the hour.
Okay.
What do you want to say, or should I say, allow Christian to probably say,
That's right. Yeah.
how have you lived with it? And then Dr. Khan can probably sum it up for us.
Yeah.
Well, the only way I've been able to live with it is first to accept that I have this problem,
Yeah.
and secondly to abide by all the precautions and
Yeah.
the things that I've been asked not to do, and the things that I'm encouraged to do, I make sure I do them, like taking my tablets, drinking water at regular intervals, not drinking alcohol. And that's one area I would have liked Dr. Khan to have explained it a bit, because they said if I can, I should avoid alcohol, or if you take it in moderation. I've been trying to understand the relationship, but I haven't.
Now, I can just chip in briefly.
Yeah.
Alcohol causes dehydration.
Okay.
That's what
Dries you
alcohol
out.
it dries you out. And just as Dr. Jampo said about dehydration, and dehydration is one of the commonest risk factors as well. A lot of people who drink heavily don't take in enough fluid. That's what happens.
Yeah.
So it dries the person out. And then again, it is said that alcohol also has an effect on the blood vessels
Yeah.
as well. So you've got a condition that affects the blood vessels,
Yeah.
and then you're taking alcohol, so it increases your risk.
Yeah.
Yeah. So there is another question, Dr. Khan. Does weight has a direct connection to multiple DVTs?
You see, I don't want to say a direct effect, but obesity is a huge factor, because people who are morbidly obese, what do you normally associate them with? Lack of mobility.
Yeah.
Yeah, lack of mobility, and
activity
quite commonly,
intolerance,
that's
isn't
right,
it?
quite commonly, and because they don't move a lot, they'll be developing the varicose veins, because the venous system gets weak as well.
Yeah.
The swollen leg, the dependent edema, they develop all the risk factors because of the obesity.
Yeah.
So one of the huge advice is that lose the weight. Lose the weight. Obesity now is a problem. Is a big problem for us because of the lifestyle. Because I was coming to the summing up, the lifestyle we have now, where just eat. You pick up your remote, you order, you speak to Alexa, you order, you shop online. I find that my very older patients, especially the ones who lived through the war, they are very resilient. Some of them have multiple chronic conditions, and yet they are still tough.
Yeah.
In their 80s and 90s, very tough. And yet the generation after, with our lifestyles, it is okay to live a life of luxury.
Yeah.
It is okay to have 10 cars. It is okay to, your house is just next door to the supermarket, but you drive to the supermarket, to the mall, so everybody can see your car. It looks nice. But in terms of your health, it is a risk. It doesn't give you any benefits. If you can walk, walk. I find that, you see, even when I'm doing, my clinics are usually 3.5 to 4 hours. Sometimes you're sitting down on a go. The only movements you make are within the confines of the consulting room. Are you with me? But what I've managed to plug into is that in between clinics, I would do a 10 minutes walk. So I will step out. And even just the freshness of the air, it refreshes you. Are you with me?
Yeah.
So just that 10 minutes brisk walk resets the circulation and improves the circulation. Then I come back and sit down. If you have the means, after every hour of sitting down, stand up and walk.
Yeah.
If you're sitting down for long periods of time, elevate your legs so that the blood goes back into circulation. If you're overweight, you know, it's difficult to talk about weight without offending people. But look, I've got my family pack here that I'm trying to reduce.
One pack.
My one pack that I'm trying to reduce.
Yeah.
And I can appreciate that it's not easy to lose weight. But we have to, because of the risk associated with obesity. Not just the clots as well, but the cancers and the heart problems and the diabetes that goes with it. If you've been asked to wear stockings, please wear the stockings. And if you're traveling and you've got risk factors, then by all means, take precautions.
Wow.
Yeah.
Take precautions.
Yeah.
Christian, I think I will add this on as your partner. Some of the risks that factors and even the precautions you've had to take.
Yep.
You see, other people can use any shaving blade, you know, to shave, but he has to use electric ones because it's not going to cut, because the slightest cut on his skin
And it will bleed
bleeds profusely.
Yeah.
You know, and but he's been so good at looking after himself, and I think he's become a champion of his own life and condition.
I think that's
is
the
good.
That's the key. You don't get to survive 4 episodes of DVT and 1 episode of pulmonary embolism. First episode was when 2004.
Yes.
That's 18 years ago.
Yes.
So to live that long and still doing well, it tells of the person's own discipline and their dedication to their treatment regime. If you don't do that, unfortunately, it would end your life.
Yeah. And so to finish off, let me acknowledge a few more people. Rodlin Graham says, good to know, Christian, you are here and you are a survivor. Angela Nana Otu says, Christian, crossed legs is no as well. So uncross your leg. You know, Angela, I just deliberately waited to see that we all have uncrossed our legs before I chip this one in, because at one stage we were all like that.
Cross
you
legs,
know, there are things that we do unconsciously and then we don't even become aware of it. ACSL says, what are you doing to the poor man? Yeah, but you see, he has always backed me on every single move, doing this, encouraging people to talk about their conditions and all that. So, like, why not? If not, why not? And to round it off, Dr. Khan, unless you have anything to say, I think this has been an unbelievable session.
Right,
we plan to do this topic, especially because we have experienced it ourselves in our families and all that. But it has been great. Let me just say this as well as we end. So far, we have looked at all the risk factors, and there is nothing like a patient account, somebody who has lived and survived the condition for years, and then obviously having the professional talk through, so we know how dangerous it is and how we can look after ourselves. Just to finish off, George Noinlate, you said, yes, our mission
George
is
is
on.
on,
George
yes.
is on, and it's on from the 23rd of September to the 7th of October, 2 weeks of internship training in Ghana, and we're going to do this, and I'll be bringing you live updates. Obviously, we will have 1 or 2 programs to introduce the team before we go. A full-on mission is just all about life saving. But thank you so much, Omega Live TV, Omega House Multimedia, because this platform is just an awesome opportunity to reach the community and with stuff as important as health, like we are doing now. So George says, help save lives of pregnant women and their babies in developing countries. Together we make a difference. Together we can improve maternal and neonatal outcomes. Together we make the world a better place. Donate handsomely. And I take this opportunity to say that one of our donors contributed £500 to support the mission. I have friends all over supporting the mission, so please do well to support, and we will definitely be saving lives. So on that note, I take the opportunity to say a big thank you once again, Dr. Khan, for always being a very, very strong pillar behind me and supporting me with all these programs. And obviously, thank you to Omega Live TV, Uncle Joe, a very able producer, because I'm saving the last for and then to Mami Dansoa, always creating the atmosphere and setting the scene for us to have such incredible encounters. And obviously the last but not the least will go to Christian. I cannot say how much this means to me and how much you mean to me, because we had to make some very life-changing decisions based on your health encounters for us as our family. But I think we haven't done badly at all. And for me, up and down the country doing all sorts of programs, you are always there. Or I don't know what I would do without you. So for the first time ever, I say thank you so much. And the love is deep, the feeling is real.
Wow.
Viewers, we will come your way, definitely. We will keep this program going. So watch out for more very, very special encounters coming up on dementia and so many
I
others.
wanted to chip in something with the dementia. Because you remember we said we wanted live patient experiences. So probably maybe we'll use this opportunity. If maybe somebody has within their family, somebody has dementia and they would want to share their experience with us. As we plan towards this dementia program, I think it would be worthwhile, because it's a condition we want to really expose. It's in our communities in Ghana, but we don't talk about it. Are you with me? And we want to use this platform to highlight the challenges that our very elderly are going through. So yes, many more planned session. And before we go to Ghana, we will have a live session as well on basic life support. Trust me, you don't want to miss any of these sessions coming up. I am so grateful for your patronage, or every single one of you. But do well to share our programs. It's live from Omega Live Studios in Walthamstow, London. And I would say I will be back definitely, but I am definitely a woman on a mission. So until the next time when we come here, thank you all so much, and keep donating. Thank you. Bye. It's a cut.
My name is Kofi Adoko. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adocus solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law or housing law. Aduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Aduku Solicitors on 0207 183 1479. You can locate Aduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoku. I'm a principal solicitor at Adocus Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adocus Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adocus solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law or housing law. Aduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Aduku Solicitors on 0207 183 1479. You can locate Aduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoku. I'm a principal solicitor at Adocus Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adocus Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adocus solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law, or housing law. Eduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Eduku Solicitors on 0207 183 1479. You can locate Eduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoku. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adoko Solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Eduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law, or housing law. Eduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Eduku Solicitors on 0207 183 1479. You can locate Eduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoku. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adoko Solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Eduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law, or housing law. Eduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Eduku Solicitors on 0207 183 1479. You can locate Eduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoku. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adoko Solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law or housing law. Aduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Aduku Solicitors on 0207 183 1479. You can locate Aduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoko. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adoko Solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law or housing law. Aduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Aduku Solicitors on 0207 183 1479. You can locate Aduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoko. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adoko Solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law, or housing law. Aduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Aduku Solicitors on 0207 183 1479. You can locate Aduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoko. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adoko Solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law, or housing law. Aduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Aduku Solicitors on 0207 183 1479. You can locate Aduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoko. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adoko Solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law, or housing law. Aduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Aduku Solicitors on 0207 183 1479. You can locate Aduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
is Kofi Adoku. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adoko Solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law, or housing law. Aduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Aduku Solicitors on 0207 183 1479. You can locate Aduku Solicitors at 662 Old Kent Road, London, SE15 1JF.
My name is Kofi Adoku. I'm a principal solicitor at Adoko Solicitors. I am also a duty solicitor. Anytime a person is arrested and taken to a police station, or if the police invite you to the police station for a voluntary interview, you have a right to free independent legal advice. Adoko Solicitors is authorized to provide free independent legal advice at police stations in England and Wales. So anytime you're taken to the police station, remember to say that your solicitors are Adoko Solicitors.
Are you in the UK and in need of immigration help? Do you require expert legal representation to regularise your stay or renew your existing leave to remain? Do you require advice or representation regarding a personal injury or criminal matter? If the answer is yes, then you do not need to look any further. Aduku Solicitors is here to provide you with all the expert legal advice and representation you require.
Be it immigration, criminal law, appeal against conviction or appeal against sentence, family law, personal injury, civil litigation, employment law, or housing law. Aduku Solicitors is your trusted one-stop legal services provider with expert solicitors and caseworkers on standby to assist. Our police station emergency number is 07792 459 339. You can also call Aduku Solicitors on 0207 183 1479. You can locate Aduku Solicitors at 662 Old Kent Road, London, SE15 1JF.